This episode is brought to you by LifeLock. The holidays mean more travel, more shopping, more time online, and more personal info in places that could expose you to identity theft. That's why LifeLock monitors millions of data points every second. If your identity is stolen, their US-based restoration specialist will fix it, guaranteed or your money back. Get more holiday fun and less holiday worry with LifeLock. Save up to 40% your first year. Visit LifeLock.com/podcast. Terms apply.
Atheists, agnostics, long-haired weirdos, short-haired weirdos, vandals, hooligans.
The government, hug the government, love the government, hug the government, love the government, hug the government.
Welcome to The Politics Guys, a place for bipartisan, rational, and civil debate on American politics and policy. I'm Northern Kentucky University political scientist Michael Baranowski. I'm joined today by my conservative counterpart, Cleveland area attorney and defender of freedom, Jay Carson.
Hey, good morning, Mike.
Hey, Jay, how are you doing this morning?
It's good. It's been a good week.
I'm glad to hear that. It's not been a bad week for me, too, and I am looking forward to getting to it. We have, as always, a bunch of things to talk about. But before we do, I just want to say thank you to our two newest Patreon trial members, Anna and Magfan, which sounds like, I don't know, probably not a real name, but whatever your actual name is, we're glad you're here. And thanks so much for at least considering supporting us. We really do appreciate it. So, early this week, as everyone knows, I'm sure, Luigi Mangione was charged with the murder of United Healthcare CEO Brian Thompson. Mangione allegedly shot and killed Thompson with a 3D printed ghost gun, leaving behind 3 shell casings with the words delay, deny, and depose written across them in reference to common insurer tactics used to avoid paying out claims. And Mangione, who suffers from chronic back pain, may have been at least partially influenced by Unabomber Ted Kaczynski's manifesto, Industrial Society and Its Future, which he reviewed on Goodreads, calling it prescient and commenting, when all other forms of communication fail, violence is necessary to survive. And Mangione penned a short, I wouldn't call it a manifesto exactly, of his own, just 262 words, in which he claimed he acted alone and wrote, frankly, these parasites simply had it coming. A reminder, the U.S. has the #1 most expensive healthcare system in the world, yet we rank roughly number 42 in life expectancy. United is the largest company in the U.S. by market cap, behind only Apple, Google, and Walmart, which is not actually accurate. It's number 14 by market cap, but leaving that aside, he continues, it has grown and grown, but has our life expectancy? No. The reality is they have simply gotten too powerful, and they continue to abuse our country for immense profit because the American public has allowed them to get away with it. And plenty of Americans seem to agree. I mean, there's been this outpouring of support in some really disturbing ways, I would say. And some folks who are understandably not okay with murder, I hope that be most everyone, at least support the sentiment, I think, that drove Mangione. For instance, Massachusetts Senator Elizabeth Warren said, the visceral response from people across the country who feel cheated, ripped off, and threatened by the vile practices of their insurance company should be a warning to everyone in the healthcare system. Now, she added, violence is never the answer, but then said, but people can only be pushed too far. And she later... That's
how I was going to open the show, Mike, I was going to say, how am I doing? I was going to say, Mike, I can only be pushed too so far. But go ahead.
Violence is never the... And then she kind of pulled back and later in the week told Politico, violence is never the answer, period. I should have been much clearer that there is never a justification for murder. Now, Senator Bernie Sanders called the murder outrageous, but also noted that the murder tells us that millions of people understand that healthcare is a human right and that you cannot have people in the insurance industry rejecting needed care for people while they make billions of dollars in profit. So, Jay, there's a lot here, and I'll just kind of throw this over to you. What's your big takeaways from all that we've seen in the last week or so with this?
I do have to note that my first takeaway is, if Trump had been working at that McDonald's, they would have caught him much quicker, much quicker. But no, I think the response has been troubling, not necessarily surprising, and based on things that we don't really know yet, right? I mean, we're sort of assuming that his motive was he's had some sort of claim denied or treatment denied or something like that. We don't know that for sure yet, and I think maybe Warren and Sanders are extrapolating. I don't like the violence is never justified, but I think that's just a bad formulation. That sort of says, oh, your outfit looks really nice, but you know what I mean. I think Warren was wise to then amend her remarks and be more clear. I'm more of the John Fetterman school, and Fetterman's comment was, as far as the lionization of this guy, is this is an asshole who's going to spend the rest of his life in jail. And I'm coming to like John Fetterman more and more as the days go by. I guess that's where I'm at this, and this is something that's sort of, I guess, a little weird, right? If this is such a groundswell throughout the country in terms of concerns about healthcare, about coverage, about denials, and so forth, one would have thought it would have been a bigger political issue. It would have come up during the election. It would have, there would have been legislation. There would have been hearings on this sort of thing. But we really haven't seen that. Now, again, we did see it, I'd say, back in, 2006, 2007, 2008, in the lead up to Obamacare. I think there was much more of a sense of public frustration. But I think if you look at a lot of the numbers, and I don't have actual real numbers, but you probably do, but most surveys say like the vast majority of people are satisfied with their healthcare system. Or I shouldn't say their healthcare system, but their healthcare provider, their insurer. And you're going to have times when insurers deny claims sort of by necessity, right? It's something is either covered or it's not covered. Their job isn't to cover everything. So I guess that's my takeaway is I'm a little, again, it's one of those words that I think I want to make up, right? That you're initially surprised, but then in retrospect realize, no, I shouldn't have been surprised in terms of the backlash, the lionization of this guy. Also the weird sort of, that he's so good looking and all that. I don't think he's all that great looking myself, but the left has a soft spot for their Che Guevaras and so forth. But
I don't think he's necessarily, there's a lot there, Jay. And you said a lot, you said some things I agreed with, but plenty I disagreed with. Starting with the fact that Warren and Sanders are extrapolating based on what they don't know. I think that's not correct, because he did in fact leave that thing saying that, well, he had it coming. So it's pretty clear.
Well, yeah, but in terms of extrapolating, in terms of this being extrapolating this guy's feelings to a large.
Oh, you're wrong about that. You're so incredibly wrong about that. And you've been very wrong about American healthcare for as long as I've known you. And that's just how it is. And I don't mean that in a, sometimes people hear me say that. It's like, oh my God, he just wants to shut down the argument. You're wrong. Let's move on. But I don't mean it that way. I mean, I reject this idea that pretty much everyone is happy with their healthcare. Now, people are happy. If you're talking about, are people okay with their doctors and their providers? Yeah, in many cases, that's absolutely the case. But I think there is a strong consensus by hundreds of millions of Americans in this country that health insurance is just an awful mess to navigate, and frustrating and aggravating and irritating. It's like a American commonplace almost. And I'll also say that the whole thing about violence is not the answer. This is America. We believe in violence in this country. And that's why Fetterman's response, that this kind of violent sort of, this guy's an asshole, should die in prison, that's such a crappy response, but that's such an American response too. This is a guy who clearly did something that was atrocious and wrong. And yes, he should spend the rest of his life in jail. I don't have a problem with that, But the idea that, well, everyone is just, this guy is an asshole who, deserves to be. Yeah, I think.
You disagree that?
No, I think
if you shoot somebody in the back in cold blood, I mean, again, maybe it's perhaps a little accrued.
I guess I feel that.
Don't you think that's sort of, isn't that something sort of an asshole kind of move?
I guess I feel it's reductive. And certainly what he did was horrific and wrong. But does that mean that he is I don't know, I guess I reject both the lionization of him as some sort of a hero. I find that disgusting. But I also find the sort of dehumanization of him as some scum also disgusting and wrong. People are complex, just like Brian Thompson. All of a sudden, Brian Thompson is apparently, he is like this wonderful, beautiful family man. And yeah, that's maybe part of who he was. But, you know, that's only part of who he was. He ran an organization that was designed to make money, you know, through, in part, denying claims, paying out as little as they possibly could in claims while taking in as much as they could in premiums. I don't blame Brian Thompson, right, for that. That would be wrong. It's part of how the larger system is. And I think where we go wrong so often in this country when we're talking about policy is we focus on personalities. Well, Donald Trump is evil, or Luigi Mangione is an asshole, or what have you, because it's easier for us to focus on personalities because we understand that more intuitively than systems and processes and institutions. And that's the real problem. I read the op-ed piece that United Healthcare's parent group CEO wrote in the New York Times a few days ago. And it was crap. It was the sort of thing that it clearly was vetted through the lawyers and focus grouped and all that sort of thing. And it said absolutely nothing. But I guess it didn't say nothing. He said, this is a bad system and no one would create a system like this. It's horrible. And yeah, that's the one point that I think people tend not to grasp. And so I guess focusing on the personalities, I think, is not wrong, but really misguided if we're trying to sort of understand how we might want to make the system better for everyone.
I guess there's two questions there, right? One is, do we want to make the system better for everyone? Sure. The second is are we saying, you know, well, look, I'm comfortable with, and I'm not judging Mangione on his personality. I'm judging on the fact that he apparently shot somebody in cold blood in the back, which gives me some clues as to his personality. That yes, he is a bad guy, right? I mean, I think at some point.
See, I want to stop you there. I want to stop you there.
With him,
I want to stop you there.
Shooting people in the back
or not,
that makes you, by definition, a bad guy. If you want to say, well, he was, you know, but he meant well. I mean, I think that's the problem that I get into. Or, well, he may have a point there because healthcare does suck. Yeah. And I guess my question to you is, well, the United Healthcare is, as you said, their mission says, you know, they make money by denying claims. Well, that's, you know, setting aside whether that's completely their mission or not, they have to, you know, allow a whole lot of claims or else no one's going to go to them. The alternative, I mean, Medicare, Medicaid deny claims by necessity. That's sort of a, you know, if you're asking someone else to cover something else for you in the nature of insurance, in order for them to do that, they have to have some universe of knowing what they're paying for and what they're not paying for. And I think that happens in any kind of healthcare system. Now, if you want to say, look, we need Medicare for all, sure, let's do that. But I'm kidding. I don't really want to do that. But Medicare would of course deny some claims. They would pay claims at the lower rates, make it more difficult to find providers. You might have to wait, et cetera. So what I'm saying is you're sort of pointing out that there's this problem with the United States healthcare system. I'm looking at this as it's a larger problem of a scarcity.
Yeah,
period,
and
right? There's always more supply than there is demand.
I agree 100% with that. Healthcare by necessity will always have to be rationed. And so the question isn't, do we have to ration healthcare? The question is, how does that happen? And who should be in charge of the rationing? And myself and many folks on the left argue that healthcare, that the rationing should happen through the political process because that way we believe there is greater accountability than through market forces. And you would disagree with that.
I would disagree.
Yeah, and I would say that the evidence of basically every wealthy country in the world says that I am right about this, and your position is much harder to defend. And I think we should come back to that idea of Bernie Sanders. He said about healthcare being a human right, and I think there's something to that. I don't think that all the healthcare you want, whenever you want, as quickly as you want. No, but I do think there's a good argument to be made that a very basic fundamental level of healthcare that's available to all without having to impoverish folks or drive them insane with paperworks and pre-authorization, all that kind of stuff. I think, yeah, you can make a good case for that sort of thing. And in fact, that's kind of the decision. Go ahead.
We sort of have that to some extent.
No, we don't. We don't at all. Now, we have great health care for people who are, upper middle class and above. It's fantastic. But we have the most unequal healthcare system of any wealthy country in the world. And that's been the case for a long time. And it's not going to change. And the reason it's not going to change is because the insurance industry, the provider industry, they have so much economic power. Let's go back to 2009, 2010. And this is when, President Obama and the Democrats in Congress pushed through the Affordable Care Act. What a lot of people either don't know or forgotten is that initially what Obama proposed was that there would be what's called a public option, which would basically be a publicly based insurance option that people could buy into that would compete with these private insurers. And this would have been truly transformative. This would have been much more along the lines, or at least a pathway to the sort of healthcare systems that essentially every other wealthy country in the world uses. But what happened was the insurance industry, the healthcare industry freaked the hell out and just completely killed that. And so what we got instead was a multi-billion-dollar bonanza for health insurance companies. They were essentially bought off for this reform. For instance, since the Affordable Care Act passed, United Healthcare has grown at something like 4.5 times more than the average S&P 500 growth rate. I mean, it's been great for them. They were all for this, and so.
Well, I think you could argue there are other factors that fueled its growth other than the Affordable Care Act.
Absolutely. There are other factors.
Some big ones being demographics, but go ahead.
But there are other factors, but there's no question that this was a great thing for the health insurance industry. And so, I mean, we're not going to, I guess some people call this a senseless killing, and I agree it was a senseless killing. I understand Mangione's motivation, but it's senseless in the sense that it's not going to change anything. Because the structural, the political orientation, that what we have in place, that's not going to change at all. So we'll focus on this for a week or two. But the fact of the matter is that the big things in place, the money, it's not going to allow any sort of fundamental change. The best shot we had at that was in that weird kind of unicorn moment where Democrats had control of, both branches, or both of the legislative and executive branches, and had that filibuster-proof majority for that year and a half or 2 years. That's not going to happen at any point in the future. And that was really the only way we would have seen any sort of fundamental change to the system. And so we're stuck with what we have now, I guess. And I don't think you would disagree with that.
No, I might not say stuck, but yeah, no, I think we'll have what we have now more or less and continue with that for some time. My question, my issue, I guess where I would push back on you is if people dislike weights, bureaucracy, paperwork, all that, handing it over to the government would seem to be the exact opposite way of where you'd want to go.
Well, that's wrong. And that's wrong because we know that from the experience that we have with the the various sort of subsets of socialized medicine that we have here in the United States. And I can speak to this from personal experience as some listeners, and you know, Jay, that I have been sort of under the auspices of the VA healthcare system now for the last not quite year. And what I have found is that my wait times, the bureaucracy, the red tape is so much dramatically lower than it was when I was in a private insurance. It's just, it's head spinning to me. And so, and not only that,
although, I mean, I think you would have to, that comes after some reforms
sure,
at the
absolutely.
VA, from about several years ago when that was not the case.
And that's the great thing about a system or the potentially good thing about a system that's set up to respond to the political system, is that people actually do have a way of changing things. And there was a public outcry. Legislators stepped in and they made some changes and it got better. And that's the way it should work. But that's not the way it works. And you can do what you want. You can even murder a United Healthcare CEO, and that's not going to change anything at United Healthcare. And it's not, again, it's not, I don't blame the higher ups, the executives there. They are simply responding to, they have an obligation to their shareholders. It is right. It's the system. The logic of capitalism says, hey, if we don't meet this obligation to our shareholders, someone else will, or they'll fire me and get some other CEO in there. So it's wrong to say that Brian Thompson, I think, is a villain. It's a systemic problem, and that's why I like the system with much more public input through the political process, where people have more real agency.
Do you think? I mean, the VA model would be scalable though to a national level for our country. Again, setting aside that Sweden's something else, right? And I think that sometimes can be the issue. If you are head of healthcare for Sweden or Norway or Luxembourg or something like that, that's a different kind of system that you're running than it is for 360 million people.
Sure, but it's not Sweden, it's not Luxembourg. It is literally, Jay, every single other wealthy country in the world. It's not just these few Northern European sort of countries. It's everyone but us, Jay. Everyone. And, it amazes me how we can, so many people can just say, well, that wouldn't work. It works every other place that it's been tried better than here. And you're right. There are some confounding factors there, but the fact is we have a bad system. We not only that, but fiscal conservatives should hate our system too, because this system of all these multiple middlemen paying for this stuff is incredibly costly and inefficient. CBO estimate from, I think it was 2020, said that this adds something around $500 billion in cost. That's real money, right? And so it doesn't actually boggle the mind that we don't change it, because there are a lot of people who are making a lot of money off of this system and they don't want it to change. And so it's not going to change, unfortunately. And that to me is sort of profoundly depressing. All right. Well, before we move off of this, let's say I did want to ask you kind of a more philosophical question about that. Bernie Sanders, mentioned healthcare as a human right, and I wanted to get your take on that.
So I think we talked about this before on other shows.
I think so.
And I would say, yes, access to healthcare is a human right. I would think that there is some sort of base safety net, right, below which you should not fall, right? That the government should. And my point I made a couple minutes ago is we sort of have that, right? I mean, if you walk into any emergency room in the country, they're required to treat you regardless of ability to pay. And that in and of itself is another issue, strain on the system that we could talk about. But we have that, right? And we have Medicaid, we have Medicare. And I guess that's, the question is the human right to get everything you want for free? And that's where I think we depart, because I look, apparently, from what we can gather, Mangione had this, significant back surgery. We don't know if it was United that paid for it.
No, it wasn't
didn't
United.
Pay for it,
He
whatever.
wasn't. Yeah, United wasn't his insurer.
So it's sort of to say that, well, look, he didn't have access to healthcare. Well, no, he plainly did.
But access, I think you're right on a number of things here. Obviously, you're right on on the facts of, well, someone who, comes in with a sucking chest wound or something like that. The ER can't say, well, show us we want to make sure you can pay for this before you're treated, right? But I think what Sanders and a lot of folks are arguing is it shouldn't be the case that you have to be so impoverished, or that access to health care means that, you basically have to sacrifice so much to get a fundamental level of care. Because you're right, there is a Medicaid. But again, should healthcare drive you into bankruptcy, access to it? You see what I'm saying here? And I think that's really the point, is that, and this is what I would argue, is that a certain basic level of coverage, including and especially, I would argue, preventative care, which is so incredibly important because it's actually more cost effective. When people feel like, well, I can't go in because I'm not covered, and so things fester and become worse, then all of a sudden they're much more
right.
of a
Then they're in the ER. Yeah.
Exactly.
No, I'm like, I've for the last, almost 12, nearly 15 years now, I've served on the board of a nonprofit that provides free or low cost healthcare to people who can't afford it. I've been doing this for quite a while. Originally, it was the organization was solely privately funded, and again paid for, no charge, primary care for people who needed it. We since a couple of years ago merged with a federally qualified health center, which brings in different things, because then you have Medicaid payments and government support and all that. But the mission is still very much the same, that it provides primary health care to people who need it. So you get folks in there and they're controlling their blood pressure, their diabetes, these things that eventually drive bad outcomes in the ER. And the idea is it's a overall savings to the system, to insurers, to the country when you're doing the preventative care. And this, we provide this care for, I think it's up to 200%. And it's like free to a certain extent. There's like a sliding scale based on your place on the, the poverty line, income, I think up to 200 or 400%.
And this is what I'm talking about. And this is the sort of thing that if it were actually scaled up and not just a nonprofit, but it were actually government policy, this would actually not only provide much better health care, but it would be much less expensive overall.
Right. But that's what I'm saying is this exists. This is government policy. This, I mean, anyone can walk into, I can get people addresses if they want, any of these healthcare centers, and, you would pay, depending, again, sliding scale, from zero to a, again, nominal sort of amount. And it's like a regular medical practice. You see a doctor, and you have your doctor, and that's your primary care physician, and you can go and return, and treatment plan and the whole bit.
You're missing my point. I think
that's why I think I'm viewing this from a different place, that things are not as broken as one might seem, and apparently Luigi Mangione didn't know about this thing, and I mean, I guess that's where I am. We've expanded. I mean, that's
okay. When you say he didn't know about this thing, now, this organization,
thing being that there are plenty of healthcare,
but there aren't plenty. I mean,
now maybe not everywhere in the country.
Yes, thank you.
But available. Yeah.
This reminds me of the people who say, well, we don't need government programs. A private charity and organizations and nonprofits will take care of that. And it's just simply not. It's great when it's a great thing. It sounds like a fantastic organization that you're on the board of. But the problem is it's not done to scale. And the problem, let me finish. You've been cutting me off a lot here today. The problem is it's not done to scale. And if you want to do it to scale, it's radically inefficient to do it with thousands of little organizations, all with their own different formats and codes and this and that. You get so many more economies of scale when you do it on a nationwide level, and it becomes much more efficient and it becomes much less expensive. And that's so I think, yeah, the sort of thing, what you're talking about with your organization, that's what we need, but that's not what we.
No. I think you're misunderstanding me. It's a federally qualified health center, FQHC. And that's the whole point, is there are these big federal standards, federal guidelines that everyone has to follow so that it is homogenized across the country. There's these different rate payments. And I mean, you'd love it. It's all kinds of reimbursement formulas and how much you get back from the government based on one thing or the other. And at one point it was this, weird metric of the average A1C of patients, it turned on like an extra, like the organization would get like an extra $1 million to $2 million of federal money, depending on what the average A1C of certain patients were. And I suggested just, have somebody, follow these people around and smack a donut out of their hands. But what I'm saying is the government is very, very, very much involved in this, and they're around the country. And I guess I'm just still not seeing I'm saying the government is already doing this. And this is already part of policy. It has been for some time.
Yeah, I'm not saying that the government isn't doing this. I'm saying it's not done nearly to enough scale and nearly in a coordinated enough way.
Okay.
So, and for a minute there, you sounded me. You were kind of like channeling RFK Jr. with the whole smack the donut out of their hand sort of thing, because he said, right, we just need to get people to eat better and to live healthier and not take drugs. And, it's weird in a way. I'm like, yeah, he's right, except that would basically require a change of the entire culture of the United States. And it's just so ridiculous. And here's a case where I never thought I'd say this, but I kind of agree with Elon Musk, who earlier, I think it was this week or last week, said, one thing we could do that would be hugely important and would be incredibly efficacious would be if we made GLP-1 antagonists low cost or very low cost or free, depending on income level, to millions, hundreds of millions of people in this country. And for people who don't know, those are because that really regulates a lot of those things that, the diabetes, blood pressure, that sort of thing, because treatment of those sort of chronic things is by far the vast majority of healthcare spending. And so
that is the two biggest, conditions that. Yeah, exactly.
And so I think, that's in a way, one thing I feel optimistic about is the fact that we now have these drugs. And it really, I think, could make a huge difference, because it's not like whatever RFK Jr. thinks. It's not like people are going to start eating healthy. It's just not going to happen because, Pop-Tarts taste better than broccoli, and they always will for, pretty much everyone. And so telling people to eat broccoli is not helpful. But if you can say, well, if you're going to have a Pop-Tart, at least, take this drug. Well, that's going to be a lot more, I think, pragmatic and realistic here, which is yet another reason why I think RFK Jr. is a horrible choice to run anything. And I think you probably agree with me on that.
No, I do. But what I meant by the smack the donut out of their hands bit was there is this incredibly already Byzantine sort of system for how the federal government reimburses federally qualified health centers. And it's based on all these metrics, right? And again, it's sort of my point was the weirdness of how a lot of federal money can turn on one weird metric, based on individual choices. And it's we ended up, they got the money. So the guy apparently didn't eat the donut, but that's kind of my point is, even if you have a federal system, you're going to have this very Baroque kind of reimbursement system that then can also, perversely then drive other.
Yeah. I mean, because,
incentives.
Yeah. And you're absolutely right, because there always has to be some sort of way to decide who gets what treatment and who gets paid what for it. And so, yes, but also when you compound that, when you have all of these different billing systems and codes for, what is authorized and what is not, that just complicates it so much more. And it's so much more frustrating and so much less efficient. And we should all, left or right, want systems that are more efficient and less costly.
No, I'm all in favor of more efficiency and less cost, and I am still adamantly opposed to shooting people in the back.
Yep, I'm right there with you on that.
All right, well, that's good to hear.
Yeah. All right, well, on that note, why don't we move on?
So next up, Donald Trump has promised to end birthright citizenship on day one, along with a lot of other things. It's going to be a busy day. The problem that he may have in doing that is the 14th Amendment, which provides that all persons born or naturalized in the United States and subject to the jurisdiction thereof are citizens of the states wherein they reside. That's the 14th Amendment, ratified in 1868. The purpose of the 14th Amendment obviously was to grant citizenship to formerly enslaved persons, essentially undoing the Dred Scott decision. But scholars have pointed out that birthright citizenship sort of existed, by common law in the United States even before that. So it's going to be a difficult constitutional lift to do this by executive order or even legislation. So the next question, and some folks have speculated that what Trump might actually do is issue orders that curtail the ability to obtain birthright citizenship to some extent, but do not actually prohibit it or not actually, I guess, undo that, the 14th Amendment. One thought is changing requirements for documents that federal agencies can issue, for example, as passports, where it would acknowledge citizenship based on birth. I think that's a stretch. I think that still runs afoul of the 14th Amendment. Another speculation I've seen floated of what this order might look like would be tightening requirements on tourist visas. For example, currently you can get a tourist visa for 10 years and you can stay 6 months at a time. This would address, to some extent, Trump's concern about so-called birth tourism, where someone comes to the United States, has a child, and that child, by virtue of being born here from that tourist, is a United States citizen. My sense is that's probably not a huge issue anyway, but I think that's probably within his constitutional powers to do. So, Mike, there's really a couple things going on. The first is the bigger legal issue of what can Trump do by executive order, what could Congress do by legislation, and what would need to be done, or would changes need to be made by a constitutional amendment. And the second is the policy behind this. I think there is something a little random, strange in saying that, well, just if you're born one side of this arbitrary line versus the other, you're a United States citizen. But I don't know that there's any other way to do it, right? I mean, the lines on the map mean something. And what would be the implications then if you completely got rid of this idea of birthright citizenship that has essentially been with us certainly since 1868, and I think more realistically since 1776.
Hey, it reminds me of that old Kissinger quote: "The illegal we do immediately; the unconstitutional takes a little bit longer." It seems weird. Well, first off, I'll say that Donald Trump has, of course, mischaracterized this entire issue, or rather, I guess I'll say it, lied about it. He's repeatedly claimed that the United States is the only country that has birthright citizenship.
Right, and it's not. There's plenty of others.
There are 32 other countries.
30 some?
Yeah, 32 other countries. Basically, well, it's Canada, Mexico, and every other country in Central and South America except Colombia and the Dominican Republic. There are 2 countries in Africa that have it as well. So, but I'm sure you've found this at least somewhat amusing as a sort of a student of the Constitution, the sort of weird legal rationales, that arguments that have been made to sort of twist the meaning of the 14th Amendment, saying, well, let's really focus on that subject to the jurisdiction thereof sort of thing. And what does that actually mean? And it's pretty clear. I find it almost impossible to believe that the Supreme Court, which, of course, if Trump does some of those things you suggested, which there would be court challenges, that the Supreme Court wouldn't say, oh, sorry, the 14th Amendment says they're citizens and you cannot deny privileges and immunities to citizens, right? I mean, there's a pretty clear equal. Right. And so this is not going anywhere. To me, the more concerning thing, and I think it's much more likely to happen, is what Tom Homan, who's going to be Trump's border czar, and that's not a Senate confirmed thing, so he's going to be the guy. He said, if you come into the country and have a child, that's on you. You can either take the child with you when we deport you, basically, but that's on you. And so I can totally see the administration doing that sort of thing. And I guess, to me, Jay, it's just...
And setting aside the policy piece of it, they would be within their constitutional rights to do that. Yeah,
absolutely. Absolutely. But I guess more generally, they just seem so fundamentally anti-American to me. I don't know what you think, but that's saying that's always the thing to me about America is if you're here, if you're born here, you're one of us. And this idea that, I understand that's a big part of Trumpism, the us versus them sort of thing. But the idea that someone who's born here is not one of us is, I don't feel it's just wrong. There's something inside me that just recoiled, that just feels just utterly repugnant to me. And
that's the common law talking.
Yeah, there you go. I expect you'd feel the same way, right?
Yeah, no, I do. Again, this is our nation is unique in, this, again, it's sort of a cliche, right? I say again a lot, but I repeat myself too much. It's a cliche to say that we're a nation formed on ideas as opposed to we just happen to be this tribe of people who controlled this patch of land for the last, 800 years and this side of the river, and that's the boundary. And I think that is very much part of America, is the idea of self-invention, reinvention. And, even if it wasn't, the 14th Amendment says what it says. And keep in mind that the 14th Amendment was put into place because of an atrocious, following a civil war, but to undo an atrocious Supreme Court decision that essentially held the contrary, right? That enslaved persons were not citizens, even though they were born here. So I think the idea of birthright citizenship is solidly built into, again, the American common law and our Constitution. I understand the argument of well, look, it seems sort of cheating if someone's going to just dash across the border, have a kid, and then say, this is this weird arbitrary line. But that's the lines mean something, right? And if you are here legally or illegally, you're subject to the jurisdiction of the United States. You're subject to all of the constitutional rights of people. I shouldn't say all, just about all the constitutional rights of someone who is a citizen. So yeah, from a policy aspect, I don't think it's a great sell either. And it arguably sets up this weird sort of, two classifications of citizenship or residency that I think the framers would not have approved of, and I think would be a bad idea. And secondly, it sort of runs contrary to some of Trump's other rhetoric about the dreamers and others, right? Who are who didn't do anything by choice. So I get that. I understand the issue with the anchor baby kind of argument. But I don't think that supersedes what we were built on the idea that if you're born here, you're an American.
Yeah. To me, this is very different. Well, I make a conceptual distinction between this and the border security thing. I think that borders matter and that we do need to control immigration into this country, and that while I am all for welcoming in a lot more people than we currently welcome in, I also think it's important to have them come in an orderly way and know who we're letting in and make sure that the bad hombres don't necessarily get in, right? But that's a very different thing than this. And so I understand how it's kind of seen as part of one thing.
The rationale is that the birthright citizenship is the incentive for illegal border crossings.
Yeah, and I guess,
I wouldn't disagree that in some cases it could be.
Yeah, in some instances, I think it certainly is. And I guess it feels to me like I understand sort of the motivation, the instinct, because so much of what Donald Trump pushes is driven by grievance and this sense of unfairness, right? That people are cheating the rules and getting around the rules. And I think it comes from a place of anxiety and insecurity about how the country is changing in a lot of ways. And I think it's important not to just say that the people who are for ending birthright citizenship are a basket of deplorables or something like that. But I mean, there are some real issues involved here. But this, I think, is just, if we're at a point where a large group of Americans, a significant portion of the population is just really interested in just shutting down the borders to pretty much everyone, especially people who don't look like them, that to me indicates a pretty significant larger problem. It's not about immigration, it is, but it's about something pretty bigger than that. It's about a sickness in this country, really. I don't know what you think about that.
Well, I would disagree that shutting that. Well, when we say shutting down the borders, I guess that's the question, right? I think the system we have as of now is untenable. So I don't see a way to make it work without some sort of physical barriers.
No, absolutely.
Right.
Yeah.
Without someone essentially, and this comes down to, right? I mean, the border crossing, and look, this is the way border crossings are in every other country. And when you go through, there's somebody there with a gun who will either say you can come in or you can't. I think that's what Republicans mean by securing the border. Not you can cross in and then apply for so I would say there now, is that entirely driven by some sort of nativism? No, I don't think so. Some of it, sure, but like you, I think immigrants are a net plus to our country, to our economy. Something great. This is, going way back. I was at a speech by Jean Kirkpatrick. This is back in our Washington days, Mike, and she made the point that one of the most important things that immigrants bring and have brought. Now, statement was made during the Cold War, but I think it applies just as much force today. Is an appreciation for freedom and the dynamism of our economy that sometimes native-born Americans forget. And that having this, and at this point when she was speaking, this was when there were a large number of Russians, people from Central and Eastern Europe, that, Glasnost had just sort of opened up and the people were able to get out. But it applies, with equal force to Cubans fleeing the oppressive regime there, the Vietnamese boat people, and all these other groups that have fled bad places. So I'm a believer in that, but at the same time, you can't have no border, and I think that's the issue. So going back to birthright citizenship, where are you in terms of what do you think could be done legally by executive order or by legislation?
Well, I think, nothing can be done to change birthright citizenship aside from a constitutional amendment. But I do think, and I would not be surprised to see the Trump administration deporting parents or deporting parents of American citizens who are citizens by birthright, with the logic being just kind of what you got at earlier, is that once people understand that they will separate families and deport, separate parents from kids. That will actually slow that what's so-called birth tourism sort of thing, which I
would say you don't have to separate families. I don't think. Look, if you're getting into the straight ahead legal thing, it's sort of, well, if you're here illegally, are you exempted from deportation if you have a child who is then an American citizen?
And you're not.
I don't think that follows, and I don't think that's a tenable rule, because then you do create this kind of perverse incentive.
Yeah, and so I think I would expect to see the Trump administration do these sort of things. Now, I'm sure there'll be somewhat of an outcry, but not nearly enough to change that kind of policy. But
my guess is, to the extent that happens, those are going to be further down the line, right after the folks who are actual criminals.
Yeah, but to me, it's weird, because to me, this is so much smaller of a problem, even if you want to say it's a problem. And there are people who will make an argument that birth tourism is a problem. In the universe of immigration issues that we have, birth tourism, I think, ranks so low on that entire issue. If there are things like the fentanyl that's just flooding into the country, most of it through legal border crossings. Actually, that's a much bigger problem. Right? There are so many. Yeah, they're huge. It sounds like a Trump kind of term, but it's a much bigger problem. And there are so many other things, and I get. And so, to me, focusing on this just seems to be kind of missing the larger point of all of this. The fact that we have this insane backlog of millions of immigration, I think still millions at this point, of asylum cases, that we need to make some basic fundamental changes either to our immigration, our asylum laws, or to our infrastructure for dealing with this. That, to me, is so much more important than what I would see as this very marginal issue of birthright citizenship. Again, if you see it as a problem, and I don't even see it as a problem.
Yeah, well, so the way I look at this, though, is you can't always do this is just a small part of the problem, so we're not going to address it, right? I think, look, if there are things you can do, and the left always has this thing about, well, let's tackle the root causes and so forth. If you're looking at, well, what are the incentives for illegal immigration? Well, this is one of them, and is this something we could tackle? Now, I disagree that you can do it by executive order or probably even by legislation, and maybe you can do it by some of these things like changing the tourist visa laws and stuff. But I would say most people who come in and are birth tourism aren't doing so through tourist visas. So that's again, but it's sort of like, look, if you're going to say, should you fix the small holes in the fence before you fix the big holes? Maybe if the small holes are fixable, right? But you shouldn't have to wait till you can fix the big holes before you can fix the small ones.
See, to me, I don't even see it as a problem, because to me, you talked about, the people who are coming to America or trying to get into America, fleeing bad situations. These are the people we want in this country. These are the go-getters. These are the motivated people. These are the folks who want to be here in such a way that they're willing to uproot themselves from their families, their countries, their traditions, and travel in some cases, not just hundreds, but thousands of miles. My God, these seem like these folks would be fantastic Americans by and large. I want more of them, not less of them. And so that's why I say this isn't even, to me, a problem. It's like, yeah, if you're willing to risk all this and go through all this to have your kid here, bring them on. We want more folks like you.
But we need to know who you are.
Yeah, absolutely. Yeah, definitely.
Yes.
Definitely.
And we need to, again, American resources are vast, but they're not unlimited.
Oh, certainly not. But we certainly can take in more immigrants than we currently allow in. And in fact, a lot of the business community would say, yes, in fact, let's do that. Right. And so I think it's good for economic reasons. I think it's good for American society in general. And we are not anywhere close to our carrying capacity for immigrants. And so I say, bring them on. I am not an open borders guy.
Maybe I should have phrased it this way. capacity is vast, but the ability to bring in and what's the word I'm looking for?
Process or
Assimilate.
Assimilate. Okay.
Right. You will be assimilated. Is limited.
Yeah. Sure.
That assimilation sounds like a bad word, but I don't really think it is in this case.
No, especially since if people are coming here, it's not like we're the Borg, attacking them and bringing them in.
That's what I mean. That's where I get the assimilation for people who are,
They're asking, they want to come here, right? They're risking a lot to come here. So it's not about, this isn't like forced assimilation. This is like, yes, we want to be.
Right. But there is a learning curve in terms of American culture, American laws. In some cases, the jobs are not where the immigrants happen to be. There are a whole lot of other moving pieces there, right? That's what I'm saying is, if you want to say, okay, yes, we want to bring in more immigrants, which I would do, you can't just say, okay, doors are open. First, first 10 million to show up.
Yeah, no question.
That's my point as far as we have a lot of resources, but the resources in the assimilation resources are not unlimited.
Yeah, I think
going and something like Mike. Here's an example. Going back to all of my charitable work, this federally qualified health center that I'm on the board of, we do provide service to anyone regardless of their documentation status. But as part of in doing so, there are additional resources that we have to come up with for things like translators. It's folks understanding cultural differences coming in. There are issues there that I can't even won't go through all the cultural issues, cultural barriers to healthcare that we see. But what I'm saying is there's an expense, there's a cost to do that, and that is not unlimited.
No, absolutely not, and that needs to be back. I think actually immigration is one of those issues where I think you and we're not exactly in lockstep, but I'm to the right of most of my party, a lot of my party in immigration. You're to the left of plenty of people in your party in immigration, and so you and I sort of meet in the middle, I think, on a lot of.
Well, I like to think I'm like where Ronald Reagan was on immigration, but
I guess maybe you are. I don't know, but if we went back to that view, at least on immigration, I'd be okay with that. So now I know that we're going to talk about not just about immigration, but about, you mentioned it's going to be a big day one for Donald Trump, and in fact, that's what we're going to talk about. We're going to lead off our midweek show with not all of those day one promises from Donald Trump, because we don't have that kind of time, but we do want to get into that. And also, by the way, I should mention, Jay, this is going to be our last show, you and me, for 2024. You're on next week with Justin. Then we have our traditional week off between Christmas and New Year's. And so we're also going to look back at our 2024 predictions and make some predictions for 2025. And depending on time we have, maybe get in some listener questions. So if you are a supporter, you will get all of that. If you're not, you'll get the first 10, 12, 14 minutes, whatever, that sort of thing. But if you want to get the whole thing and you're not a supporter, we hope you'll consider becoming. We always put those support links in the show notes. You not only get that, but you get access to the Discord and a bunch of other things at different levels. We hope you will check it out. And you can do that through Patreon, through Venmo, through PayPal. You can just, send us unmarked bills and, whatever, plastic paper bag, that sort of thing. Whatever you want to do, we're happy to take your money. And we hope we give you some decent value for it. And also, if you want to get in touch with us, something you agreed with us, disagreed with us, vehemently disagreed with us about, just let us know. There's old-fashioned email, mail@politicsguys.com. You can also reach us through Facebook, we don't really do X so much, but we are on Blue Sky now at this point. But anyway, a lot of ways to get in touch with us. Yeah. What's wrong with Blue Sky?
Well, I'm just,
Oh dear. Oh dear. That's
nothing wrong with that. I'm just,
you feel like
could attract a bad crowd there.
I'd say a better crowd, but anyway, we're never really big on X in any case, but a lot of ways to get in touch with us. That's the main point here. And hey, whether you're a supporter or not, whether you follow us on any of these social media sort of things, which again, not a big thing for us. We really would appreciate it if you could subscribe and rate and review us on our on whatever podcast app you're using. It really does make a difference. It only takes a minute or two, and again, really helps us out. And as always, we really do appreciate our fantastic executive producing team, Wilma Moreno, Daniel Toe, Ryan Beasley, and Don Oglesby. We'll be back with a new episode for you next week. We hope you'll join us.
This podcast is part of the Democracy Group,